How ankle arthritis is diagnosed. If ankle arthritis is suspected, doctors will start with a medical history to determine a diagnosis. They'll ask when you noticed your symptoms, where you feel pain, and how the symptoms affect your life. They'll examine your ankle to check for signs of arthritis in the joints, such as swelling and tenderness. Other tests can assess whether other types of arthritis may be responsible for the ankle pain, such as blood tests that measure inflammation and antibodies to rule out inflammatory arthritis, or testing of joint fluid for uric acid crystals if gout is suspected. Imaging tests such as X-rays can help confirm a diagnosis and determine the extent of the joint damage. Treatments for arthritis in the ankle. Ankle arthritis doesn't have a cure, but many treatments are available that may help relieve pain and improve function. The goal with these treatments is to help patients function and do their daily activities with less pain, says Narendra Bathina, MD, a rheumatologist at the University of Vermont Medical Center and assistant professor at the Robert Larner, MD College of Medicine at the University of Vermont in Burlington. This can also result in better quality of life. Medication for arthritis in the ankle. Medications are an important part of treatment for arthritis in the ankle. They can help slow bone loss, relieve inflammation, and ease pain. Here are the types of medications used commonly in arthritis treatment. Nonsteroidal anti-inflammatory drugs, over-the-counter medications like ibuprofen, Advil, and naproxen, Aleve, as well as prescription NSAIDs, can help relieve pain and swelling in the joints. Even though many NSAIDs are available over the counter, they can have side effects such as stomach ulcers and kidney dysfunction, especially when taken for the long term and/or in high doses. Oral corticosteroids. These quick-acting drugs help stop inflammation and are often used to manage flares in rheumatoid arthritis and gout, says Rajat Bhatt, MD, a community rheumatologist with offices in Richmond, Pearland and Greater Heights, Texas. It's best to use corticosteroids in the lowest possible dose for short periods of time, as they can cause a range of serious side effects, including bone thinning and high blood sugar. Steroid injections. In certain cases, steroid injections into the ankle joint can help relieve inflammation. These shots shouldn't be done repeatedly, though. Frequent injections damage cartilage, says Dr. Bhatt. Also, we try avoiding tendon injections and tendon ligaments close to the joint. An occasional shot, though, can offer temporary pain relief and reduce inflammation. No more than 3 injections per year is the standard of care, says Dr. Archer. Analgesics. Analgesics such as acetaminophen, Tylenol, help with pain relief. That makes them good for people who can't take NSAIDs if they're allergic to them or have stomach issues. You can also combine analgesics and NSAIDs, Dr. Bhatt says. Topical creams, over-the-counter topical pain relievers, salves, rubs, or balms are an alternative, says Dr. Bilal. They're good if you can't take oral medications or if medications aren't helping with the pain. Examples include capsaicin cream over-the-counter and the prescription NSAID diclofenac, Penzade, Solaraze, Voltaren gel, Dr. Bilal says. Gout medications. Some gout medications help prevent future attacks of joint pain and inflammation. Others relieve an acute attack's pain and inflammation. Some people take both types of gout medication. DMARDs, disease-modifying anti-rheumatic drugs include conventional immune-modifying drugs, such as methotrexate, as well as biologics, which are more targeted to certain immune system chemicals and pathways. These include such drugs as Humira and Enbrel, work slowly to change the course of inflammatory disease. They're only used to treat inflammatory arthritis such as psoriatic arthritis and rheumatoid arthritis. Lifestyle changes and home remedies for arthritis in the ankle. Lifestyle modifications are a big part of helping treat arthritis in the ankle. The most important lifestyle change a patient can make is a commitment to healthy eating and exercise, says Dr. Archer. Unfortunately, pain from arthritis can force a patient to become more sedentary, which in turn can cause depression and overeating. Diet is 80% to 90% of the battle. Soothe with heat and ice. Stiff and sore ankles can be relaxed and soothed with heat therapy. Ice can help numb areas affected by joint pain and reduce inflammation. Ice therapy is helpful for acute exacerbation of arthritis symptoms, swelling and redness, and heat is good for chronic pain symptoms, says Dr. Archer. Do ankle-friendly exercise. It's important to control your weight with regular, low-impact aerobic exercise. Keeping your weight close to your ideal BMI is the best thing you can do to control your pain and symptoms, says Dr. Archer. As little as a 10-pound weight gain can increase stress on your ankle. This extra weight can weaken tendons and ligaments, which makes sprains and strains more likely. Do gentle exercises that don't stress the ankle joint, such as swimming or cycling. Walking is one of the best exercises if done correctly with good shoes, says Dr. Bott. Limit high-impact activities, such as running or tennis. Also stay away from soccer and kickboxing, says Dr. Bott. Invest in your shoes. Cushioned shoe inserts can help create less pain in the ankle joint. A major cause of ankle arthritis is trauma. Reducing the amount of high-impact activity and providing cushion to the ankle joint helps prevent joint damage, says Dr. Bilal. A rocker bottom added to the sole of your shoe can help decrease impact on your heel while standing or walking, says Dr. Bilal. Go for physical therapy. Specific exercises can help your flexibility and range of motion and strengthen the muscles in your ankle. Your physical therapist can develop a program that's right for you. Here are some range of motion exercises, including some for the ankle, you can try at home. Get a supportive ankle brace. A brace called ankle-foot orthosis can help hold the ankle joint in position. It will support the joint, take pressure off the ankle, and prevent extra motion. It spans both the ankle and foot and looks like an ankle brace with a foot orthotic attached. Most people start with an over-the-counter brace, then if necessary, get a fitted one from a foot and ankle specialist or podiatrist. Most are worn inside the shoe, though a new kind is worn outside the shoe. Custom-made orthotics are the best choice for ankle arthritis, says Dr. Archer. Usually ankle arthritis is asymmetrical. Prefabricated devices don't provide as much relief. A custom device addresses all the issues specific to each foot. Eat a clean diet. As we shared above, maintaining a healthy weight helps reduce stress on the joints. Losing excess pounds leads to less pain and increased function. Avoid processed foods and foods high in sugar, especially if you have gout, says Dr. Bott. You especially want to eat healthfully since your exercise abilities may be limited, says Dr. Archer. Diet becomes a huge factor in weight control, she says. Use an assistive device. A cane or walker can help reduce stress on the affected joint and help improve mobility and stability, says Dr. Bilal. Holding a cane with the hand opposite the hurting ankle can help alleviate pressure off the affected ankle. However, Archer says a cane should be a last resort. A cane can throw off gait and create hip problems, she says. And if you're looking for arthritis treatment according to traditional Chinese medicine, then discuss with us in the pinned comments. Thanks for watching.